So this is a useful technique. This is the type. These are the lenses. This is the lens which is the original lens which was used. Made for this is the artisan lens, but being very expensive. So we have a clone which is made in India, which is of a similar design. And the overall length is about 8.5 millimeters. The optical diameter is, or the diameter or the breadth is 5.5 millimeters, and it has a 10 degrees angulation. So the advantages, as I said, about this technique is it is relatively quicker. It is less it involves less manipulation inside the eye. You don't need too many special instruments. Suppose you need one lens holding forceps, and I think it's easier to learn than the other methods. The disadvantages being that you need one special type of a lens which is not utilized for any other circumstance. Then it is dependent on the iris tissue, health of the iris tissue. It should be the iris should be good and healthy, so that you can clip the lens onto it. Then pupil gets distorted many a times, so it gets oval. It doesn't remain round. That is one of the things. Cosmetically, it may not look nice, and also the pupil may not dilate very well afterwards. But the lens size, when a bigger lens is used, then the pupil dilates pretty nicely. And the incision has to be about 5.5 millimeters. Although you can use one can use the SICS technique or the scleral tunnel. So here are a few cases. Here is a traumatic cataract, which was appeared to be a very dilated fixed pupil, and the PC was damaged. So after having removed the lens, done an anterior vitrectomy, I am now implanting the IOL. This is a limbal incision, so corneoscleral incision at the limbus, and the lens is slipped inside the eye, rotated in the horizontal direction, and then you have to hold it, make it stable and steady with this lens holding forceps, which I have got modified to little extent to make it a little more slim, because the original one which is available in the market was very big and it was difficult to use it. So one has to change hands and then go on the other side and then take the lens behind the iris, and using this 27 gauge Helon cannula, one can just clip it. So this is the appearance. Here is another patient in whom a foreign body had been removed earlier in a first surgery, and there is this, you can see the corneal scar and the sutured corneal scar. The iris tissue is little bit compromised. The pupil is I thought that there was enough tissue available to be able to clip the lens. One is being a little careful in slipping the lens inside, so that it doesn't get caught in the pupillary edge. The leading edge should not get caught there. So after having put it inside, again the same procedure. This is you can see a scleral tunnel. So if you use a scleral tunnel, then you can also do away with sutures. One leaves some air inside the chamber, and by the next day it is quite secure. This is the tricky. Where the edge of the lens is and where you have to clip it to the iris, because it is behind, you cannot see it directly. An iridectomy should be done because sometimes a pupil block can occur, although the lens is angulated and you keep the concave surface forwards. So this is the post-operative condition. In this case, you can see it is pretty nice. This has been taken about 3 months after the surgery. Here is a dislocated PMMA IOL, which is there, and there was a rent in the capsule, but the lens was trying to slip into the posterior segment. So I have removed it. Again, used a SICS incision. It had to be a big incision because the PMMA lens was inside, so it had to be removed as a whole, and the same procedure has been done. Here is a case of microspherophakia in which a vitrectomy lensectomy has been done, and after that, this lens of a slightly different design I'm using because I wanted a smaller lens, because this was a smaller eye and I was able to get a lens of a smaller size, and I have used it. It is a little different, having different design of the clips. So this was the first time I was using it. I wasn't sure as to how much pressure will be required to entangle the iris or enclave the iris in the clip. So there has been a little bit of a hyphema on the right side, temporal side, and for the other side it was all right. So this is a useful technique, and it is good to have these lenses in your stock, because this is very fast and one can does not require to manipulate too much inside the eye, as you have to do in lenses with large haptics when you use them for scleral fixation. Thank you.